Hello everyone, this is Clarissa and welcome to DNP Mentor. I had planned on recording this video a couple of weeks ago, but as you all know, life can get in the way. It certainly happens to me. I have a lot of exciting news to share with you all. The first, probably the biggest news, is that I am going to start teaching at a university as an adjunct professor, and interestingly enough, the first class that I'm going to be teaching is psychopharmacology. And so it blends right in with the topic today. The topic today is Anxiety Part 3, where I'm going to discuss the differences between a treatment medication for anxiety and a rescue medication. The treatment medications are medications that are used daily. And this is whether or not the patient might be experiencing anxiety at the moment, but they're prone. And so the goal of treatment is to prevent anxiety and also certainly to have the individual at their baseline as much as possible without having that extra worry and anxiety. So remember from parts 1 and 2 of this video series is that anxiety is really something that doesn't belong, the worry of something that hasn't happened, the anticipation, can't control the worrying too much about different things, becoming easily annoyed or irritated, and certainly being afraid as if something awful might happen. And so all of these are symptoms of anxiety. For some individuals, it might be milder, and so they can go ahead and maybe get away with some lifestyle modifications, exercise, meditation, deep breathing. And for other individuals, when the anxiety disorder is a little bit more extreme, or for certain situations where there's a flare-up, then many times medications are options. So the treatment medications, gold standard would be in the category of the SSRIs, or selective serotonin reuptake inhibitor, and they work by boosting serotonin and also blocking their reuptake of serotonin. And so what happens with these medications is that they don't change necessarily the way a person might feel. So they're not happy pills, they're not chill pills. They are just restoring a function that should be happening automatically. So if you can think of an individual that just takes things in stride and worries when they have to, and when they don't, they don't. So the brain function there, for the brain chemistry, it's working the way it should. But when it doesn't, that's when there's the disorder of anxiety. And so the medications work a little bit at a time, could take 6 to 8 weeks to work. A classic one in that category is medication called Zoloft or sertraline. The dose range is 25 milligrams to 200, and it works pretty effectively. But individuals have to take it a minimum of 6 to 8, even up to 12 weeks. And so this is a medication that is used to prevent anxiety. When somebody is prone to anxiety, it's a treatment medication. The flip side of that are medications that we call rescue medications, or as needed. Now, unfortunately, the category of the benzodiazepines, which are the most common form of rescue medications, are an addictive group of medications. Now, there is a role in which they can come in handy, but it would have to be for a short period of time, maybe 1 week or two, when something acute has happened. Think about a big loss or something like that, where anxiety is reasonable, fear, depression, crying is reasonable. And so sometimes people can go to the extremes in those manners and they might stop eating, they can't sleep. So a short course of these medications would certainly be indicated. Or a lot of the times what we do is we bridge people. So if we're starting somebody on a preventative treatment medication, then we might bridge them for a couple of weeks as well. Now, let me give you an example of what the differences are. So a classic example that I like to use. So let's say, for example, that I'm in a parking lot and a car runs my foot over, and they actually stay on my foot. So there's tires on my foot. I'm excruciating in pain, crying, yelling, and you can just imagine. And so if somebody brings me a shot of morphine, certainly it's going to calm the pain down. Absolutely. But as soon as the morphine wears off, I'm going to be in the same amount of pain or even worse, because it does nothing to treat the cause, nothing to prevent it. It just gives me something for the moment. So think of this as a benzodiazepine. Where a treatment medication, what they do is it's sort of treating the cause. So removing the car, curing my wound so that the problem is resolved. And so this is what the treatment medications do. Now, Very common question. People ask me every single day when I'm in practice and they're starting medications for the first time. Will I have to be on the medication for the rest of my life? Now, it's very hard to say. Typically, if it's the first time on medication, certainly not. Sometimes there's flares, there's things. Think about COVID-19 right now that just activated a lot of anxiety that people were able to manage before with things that they were doing. Certainly socializing, exercise, connecting with people, things that activate endorphins and that they're not able to do. And so for these people, once they go back to their baseline, a normal type of pattern where they're enjoying things, they're exercising, they're planning pleasant activities, then most likely they're not going to need the medication. But there are individuals that promote a healthy lifestyle, that exercise, that read all the self-help books, and still require medication, only because their symptoms are out of control. And remember that it's the illness that will dictate the treatment. Many times individuals will say, I don't want to take medication. Now, certainly that is a choice, but their quality of life is poor. Their angst is horrible, their anxiety, their worry. And so it's not a way to live, but they can certainly choose that. But the treatment medications are 100% effective. And that is the goal of treating anxiety, is that we go into remission so that the individual might not even feel that they have anxiety. And so very commonly, once somebody's symptoms are controlled, people will come to me and say, well, I stopped the medication because I didn't need it anymore. Now, sometimes that's appropriate, but the thing is that it's a good idea, and research will show and recommends that individuals stay on medication a minimum of 6 months to a year. And the reason is this. Think about somebody starting medication with a lot of anxiety. And so they put their lives on hold because it takes over. Now, they start taking the medication, they're better, they're planning things, they're making friends, making connections, they're doing things, they're exercising, and they don't have that irrational fear, those irrational thoughts. And so they start to make changes, and so good 3 to 6 to 9 months, they begin to develop new lifestyle modifications. And so it gets cemented in. And so when they come off of the medication at that time, they are more likely to continue on the pattern that they had already been starting. And so that's the reason for the recommendation of somebody staying on the medication a minimum of 6 months to a year. Well, I hope that this information has been helpful, and I hope that you take the time to subscribe and like my channel. Moving forward, I'm going to go ahead and bring additional topics that will be useful for both students, nursing students, nurse practitioner students certainly, and also to individuals that suffer from the illness of either depression or anxiety or really any type of mental illness. Thank you for watching.